5 years and greater than the period of neonatology, that's 1 month. Basically, at some extent, some doctors consider 3 months to be still inside the neonatology. Now, for adults, when you're involved with adults, mild anemia, you have mild anemia that is going to be at different level, moderate and severe. In severe anemia for adults, less than 8 grams per deciliter for severe anemia in adult. Then adults also, mild anemia is going to be 8, moderate anemia is going to be 8 to 10 grams per deciliter, that's moderate anemia. And then mild anemia is going to be between 10 to 12 grams per deciliter. Basically, that's for mild anemia in adults. But now, when you are involved with pregnant women, mild severe anemia is less than 6 grams per deciliter, just like in the case of children. Mild anemia is when you have less than mild anemia. Moderate anemia is when 6 to 8 grams per deciliter, and then when you are 8 to 10 grams per deciliter is mild anemia. This is moderate anemia, and this is severe anemia. So that's the consideration of anemia. Now, after evaluating the HB, you have also the hematocrit. The hematocrit can tell you if there is any hemoconcentration, and there is hemodilution. Basically, that's what the hematocrit tells you. It helps you in telling if there's hemoconcentration, hemodilution. If there's hemodilution, you need either to know that there is either excessive fluid, basically there is excessive fluid in the patient, or in case of fluid overload, or there is low level of red blood cells in the case of anemia. Basically, in the case of hemodilution, you have there is excessive fluid in the case of fluid overload, or there is low red blood cells, meaning that there is anemia. Provided that you measure the HB, you see that the HB is normal, and then the patient is having a hematocrit that is low, because hemodilution is when the hematocrit is going to be less than 45%, and hemoconcentration is when the hematocrit is greater than 55%. The normal value of hematocrit is between 45 to 55%. Basically, so when you have greater than 55% is hemoconcentration, less than 55%, 45% is hemodilution. Hemodilution either show that is fluid overload or anemia. Provided that you have a patient that has a normal HB and then he has hemodilution, it means that it is fluid overload. I hope you understand it. Now, the next point is hemoconcentration. So, hemoconcentration can either tell you that the red blood cells are highly concentrated, basically in a case of polycythemia vera. Polycythemia vera. So that is one method of diagnosing polycythemia vera. And then the second element of hemoconcentration can either be low level of fluids, in a case of dehydration. So another method of diagnosing dehydration is by looking for that. So in order to know that there is no polycythemia vera but dehydration, you look also at the HB. If the HB level is if you look at the HB level and you see that the HB level is normal, and then there is still hemoconcentration, it means that there is dehydration. So those are the different elements that you try to evaluate when you have the full blood count in front of you. Is it clear? So those are the different elements that you evaluate. Now, after the hematocrit, you have the mean corpuscular volume. The mean corpuscular volume helps you to know the mean size of the red blood cells. Is it clear? And the normal mean size of the red blood cells is between 80 to 100 femtoliters. Is it clear? Now, the next one is the mean corpuscular hemoglobin. Mean corpuscular hemoglobin vary between 27 gram per deciliter to 32 gram, 27 picograms, to 32 picograms. Picogram because it is only in one red blood cells, and I've told you that I prefer this than the mean corpuscular hemoglobin concentration, because mean corpuscular hemoglobin concentration is on many cells, while mean corpuscular hemoglobin is just on one cell. So it's varies between 27 picogram to 32. Now, if the mean corpuscular hemoglobin, mean corpuscular volume is greater than 100, we say that it is called macrocytic. We say that the cells are large, they are macrocytic, the red blood cells are large. But now if it is less than 80, it means that the cells are small, they are microcytic. Is it clear? But now in the case of when the mean corpuscular hemoglobin is larger than 32, mean corpuscular hemoglobin is larger than 32, it means that the cells are going to be hyperchromic. It means that they contain much hemoglobin. One cell contains much hemoglobin, so it is hyperchromic. Why? When you have the mean corpuscular hemoglobin concentration, mean corpuscular hemoglobin, sorry, less than 27, it means that the cells are going to contain less hemoglobin, and then they are hypochromic. Is it clear? So that is how you say the anemia. You have a mild microcytic hypochromic anemia. You have a mild normocytic normochromic anemia, and those are the different elements that you have to evaluate. Now, the next thing after that on the value, the normal value, we have the thrombocyte level. Is it clear? The thrombocytes level are also very important to evaluate on the full blood count. Now, for the thrombocytes level, you need to know that the normal value of thrombocytes is between 150,000 to 450,000 cells per microliter. Is it clear? If you have high thrombocytes, you're going to score it thrombocytosis. If you have low thrombocyte, you have thrombocytopenia, and there's a degree of thrombocytopenia. Thrombocytopenia, when it is between 100,000 to 150,000, is called mild thrombocytopenia. Between 50,000 cells to 100,000 cells, is called moderate thrombocytopenia. And when it's less than 50,000 cells, it's called severe thrombocytopenia. Now the next part is the red cell distribution rate. Is it clear? CV, and the red cell distribution rate, SV. Generally, the maximum value is important. The maximum value is 100 for both of them. When you are greater than 100 in this case, or a greater than maximum value, you have a polychromasia, meaning that the red blood cells are going to have different colorization. Why? When the SV is greater, it is an anisococytosis. Is it clear? So generally, those are the normal value and the terms that you have to use if it is low. I've forgotten to tell you that when the white blood cell count is high, you say leukocytosis, and when the white blood cell count is low, you say leukopenia. So those are the different elements, words that you have to use in these cases. Now we are going to continue with the next part of the tutorial to know now the interpretation of the full blood count.